Good afternoon, everyone. Welcome to the Hidalgo County Wellness Program 2021 Virtual Wellness Fair. My name is Diana Walpa with the Hidalgo County Wellness Program, and I'm very glad that you joined us today for this presentation that we have. I know it has been a long day, so I really appreciate everybody that has been on their presentations with us. But before we get started, I want to make sure that the technology is working for us. Therefore, if you can see the slides clearly and if you can hear my voice clearly, please click on the raise hand icon that is located on the bottom of our Zoom webinar software. Again, if you can see my slides clearly and you can hear my voice clearly, please click on the raise hand icon that is located at the bottom of our Zoom webinar software. Thank you so much for everybody that has participated. It looks like we're good to go technology-wise. I do have a few reminders before we get started. Reminder number one is that we have one additional presentation as part of our 2021 Virtual Wellness Fair. Therefore, I hope that you join us this afternoon at 3:30 for that presentation. And additionally, I do want to remind everybody that we have all the presentations that we have already covered yesterday on demand available. So they are available for you to go and watch whenever you have some time. The second reminder is that you are on listening only mode. However, you are able to submit your questions via our Q&A forum via the Zoom webinar software. And at the end of the presentation, we're gonna have a Q&A session. At this point, I have the pleasure of introducing our guest speaker for today's presentation, Dr. Bilal Nassif. Dr. Bilal Nassif is a practicing hospitalist with H&I Healthcare at Rio Grande Regional Hospital. He was raised most of his life since the age of 9 in McAllen, Texas. He received his bachelor's degree from the University of Texas Pan America, and he then traveled to Colorado for medical school and returned to the Valley to complete his internal medicine residency at Doctors Hospital at Renison. Dr. Nassif makes it a priority to stay up to date in order to use evidence-based medicine and guidelines for his patients. His goal is to help provide accurate information and education to his patients so they can fully understand their medical problems and plan of care, as he strongly believes doing so will improve outcomes. Thank you so much for being here, Dr. Nassif. Thank you so much for joining us this afternoon. And it is a pleasure to have you here on the Hidalgo County Virtual Wellness Fair.
Good afternoon, everyone. Thanks for having me, and thank you all for being here for this wellness fair and for my presentation. So we can, I guess, go ahead and get started. We're just pulling up the PowerPoint here.
Great, thank you so much.
Okay. Can you all see my screen?
Yes, we're able to see your screen clearly.
Okay, perfect. So we'll go ahead and get started then. The topic that we're discussing this afternoon is hypertension, and the title of the presentation is Decoding Hypertension, or also known as high blood pressure. And again, I'm Bilal Nassif. I'm a hospitalist with the H&I Healthcare Hospitalist Group here at Rio Grande Regional Hospital in McAllen. So we can go ahead and start with just kind of dive right into it. Start with some general overview, a couple definitions. What is blood pressure? So blood pressure is the pressure of blood pushing against the walls of your arteries, and this is normal. As blood travels through your arteries, there's a certain amount of pressure pushing against the walls. And what are arteries? Well, there's two sides to our vascular system. You know, there's veins and there are arteries. The arteries are the vessels that take blood from the heart, the blood that has oxygen, takes it from the heart and distributes it to the rest of your body. like your other organs and muscle, tissue, all those. So then what is hypertension? Just means basically, it just means high blood pressure. And, blood pressure, it varies throughout the day. And this is absolutely normal. Sometimes it can be high, sometimes it can be low. Can be high, let's say if you're anxious or stressed out, or maybe you're running somewhere, the blood pressure can come up. And the same thing, that blood pressure can also be down. So some people have low blood pressure when they sleep, for example. And this is all totally normal, but the dangerous part comes when the blood pressure stays high for a long period of time. And so this can cause stress on the body, stress on the heart, and cause other health problems. And we'll break down some of these numbers first, on the numbers that you would typically see when you look at a blood pressure reading. So you have two numbers, a number on top and a number on bottom. The number on top is called the systolic blood pressure, and the number on bottom is called the diastolic blood pressure. And with the systolic, the top number is the pressure in your arteries when the heart pumps, or when there's like a heartbeat. That's the pressure on the systolic side. Then the bottom number, or the diastolic, is the pressure that is in your arteries when the heart is relaxed. Okay, so a normal blood pressure is generally, per the guidelines, is less than, the top number is less than 120, and the bottom number is less than 80. An elevated blood pressure is a blood pressure that ranges in this range here, 120 to 129. And the diastolic, or the lower number, is less than 80. So elevated is kind of like those scenarios that I was talking about. If you're stressed out, or something's going on and you're not quite at the stage of where you would call it hypertension, it's just a little bit high. And we'll talk more about that later. But hypertension stage 1 is this next stage down here, and that's where the range is 130 to 139, and the lower number is 80 to 89. Then you go on to the next stage, where your top number, the systolic, is 140 or higher, and the bottom number, or the diastolic, is 90 or higher. And this last part here is really an emergency. We call it hypertensive crisis, where the blood pressure is just extremely uncontrolled. The top number is greater than 180, and the bottom number is greater than 120, and that's something that would need to be addressed urgently, with either your family doctor or being seen at an urgent care center or ER. So those are the numbers. Now, how common is hypertension? Actually, in the U.S., about half of the adult population has hypertension. So it's quite common, and it's more common as people grow older. So in the age group of 65 to 74, actually 76% of people have hypertension. And in the age group above 75, 82% of people have hypertension. So again, this is quite common, and it's a lot of importance and stress on the whole kind of healthcare system. So yeah, it's important to discuss. And this is just like a visual representation of how it's kind of distributed throughout the U.S., the rates of hypertension. And you can see here, I mean, the darker the red, the more, the higher the rate of hypertension in that area or in that state. And you see here, these southern states generally have a higher rate of hypertension, and Texas included in that. So we can go over risk factors, and we can kind of divide these into risk factors that can be controlled versus risk factors that cannot be controlled. And let's go over those a little bit. So the ones that can be controlled, or they're by choice, you can say, are cigarette smoking, obesity or overweight, eating a high sodium diet, not much physical activity, and excessive alcohol intake. Um, and now the ones that on the right side of the slide, you see the ones that cannot be controlled are risk factors such as family history. If it runs in the family, in your mom or dad or grandparents, that's obviously something that you can't control. Your race, statistically, African Americans actually have a higher rate of hypertension. So that's something that can't be controlled. Older age, like we discussed earlier in the other slide. Gender, males actually have a higher rate of hypertension than women. And other comorbidities or other diseases such as sleep apnea or kidney disease are also risk factors for developing hypertension. Okay. So, people might ask themselves, right, how do I know if I have hypertension? And typically, hypertension doesn't actually really cause any symptoms unless it's severely uncontrolled. Um, but yeah, and to be honest, we don't have very solid or specific guidelines on when you should start screening or when you should start checking or how often. Um, but the general consensus, is if you're above the age of 40, you should at least be getting a healthcare kind of screening once per year at least, and with that you would have your blood pressure checked. But the more risk factors that you have, like we discussed in the other slide, then you should probably be checked earlier and more frequently. Okay. And a lot of people have family members who may have like a blood pressure monitor at home. So a lot of people will just, I've done it before. I've kind of played with my dad's blood pressure monitor, since I was like a teenager. I would just like to check my blood pressure just for fun. And so there's different ways, I guess, that you can have it, quote unquote, like screened. Um, and of course, before the COVID time, we would, I don't know if it's directly related to it or not, but there used to be like in Walmart, there used to be a blood pressure monitor that you can just sit down and check, and or you go to these health fairs and have your health screening done. So there's different ways to get screened, but generally these are the guidelines. What we want to follow on getting checked. So now, if you're found to actually have high blood pressure during the screen, it needs to be confirmed with a second reading, and that's to be done during a different visit or a different time. Or you can continue to check it at home. So you can buy yourself a monitor from Walmart or something and continue to check it at home. The reason really that you need that second reading for confirmation is because sometimes that first one may be a false positive or kind of deceptive, and what happens, and this is an actual phenomenon, and it's called white coat hypertension. A lot of people, when they go to a doctor's office or their medical personnel around, they get anxious, and their blood pressure may rise, and it's not their real baseline. It's just because of their anxiety that it goes up. So you never want to just diagnose it based off the first reading. You want to check it on a different visit or continue checking it at home. Now, if you truly do fall into the area of hypertension, to that diagnosis, or even let's say high blood pressure, like we had talked about that table with the numbers, you're not quite at the hypertension level, but you're elevated. Um, you know, um, you want to make sure it's being addressed, and because leaving it as is eventually going to cause problems. It can be very dangerous. Um, you're at increased risk of heart attack, stroke, and even death. So, usually we start off with lifestyle changes, and those basically on that list of risk factors that we talked about that can be controlled, that's what you're going to be working on. Reducing the salt intake in your diet, losing weight if you're overweight or obese, cutting back or cutting down on the alcohol, avoiding cigarette smoking, and starting to work or increase your exercise time. Um, the only time, so you start talking about actual medicine therapy when you're consistently high, or at that 140/90 cutoff. If you're consistently above that, that's you're already at that stage where it's indicated to start a blood pressure medication, something prescribed by a physician. So what are the lifestyle changes, kind of like we were discussing? So these are some things, just some um, little hints or tips, general kind of guidelines that you should follow. The sodium intake, two grams per day is probably the limit, but ideally less than 1.5 grams per day of sodium. Potassium, you want to try to keep it in that range as well, 3,500 to 5,000 milligrams per day. And these days, nutrition facts and labels are everywhere. And even at fast food restaurants, even at McDonald's, you can see it there at the restaurant or online. They'll show you exactly what's in that meal that you're getting. So you can check those labels and make sure that you're keeping your sodium intake in check, um, less than 2 grams per day. Limiting alcohol intake, and there's little discrepancy here. Don't this may it's a whole different topic, but there's actually formal recommendations on how much is a safe amount of drinking per day between men and women, and one drink is considered healthy or safe, and for women, 2 drinks considered healthy for men. So trying to limit it to this limit here. Um, and then, of course, last but not least, is exercise. And exercise, though, that 150 minutes looks like a lot, and it may look very intimidating, and because of how big the number is. But if you break it down into sessions throughout the week, really you can do 30 minutes a day for 5 days in that week. And this is moderate intensity exercise we're talking about. So, getting, let's say, on a treadmill, a bicycle, a jog, something that picks up the heart rate is a moderate intensity exercise. Um, we want to try to do that as our lifestyle change. The most important thing really is with all this, if you do get diagnosed with high blood pressure, and you want to create a plan and commit to it. So this is done with the help of obviously your family doctor. But while you're creating your plan, you discuss this with your family, right? Your significant other, or your children, or your parents, that this is my plan and this is what I have to do. And your family cares about you, obviously, so they will help you commit to it. But the important thing is just creating the plan, and hopefully everyone else will be involved with it. If you are actually prescribed medications by your doctor, it's important to actually take those medications as prescribed. And you know, there these days there are um, actually this has been for a while, but HEB and Walmart, for example, have like their $4 medication list. You know that can be available. It's available for everyone, and so a 30-day supply of a medication will cost $4, and they carry probably some of the most common ones, especially for hypertension. So there are resources to be able to get those medications and make sure that we're sticking to the prescribed regimen by your doc. Because unfortunately, only 25% of adults with hypertension actually have it under control. And it's sad, it shouldn't be this way. And there are a lot of factors behind that, but that's probably one of the biggest points of having a conference like this, for example, is just educating and making sure that that number changes. We want everyone to have it under control. In 2019, more than 500,000 deaths in the U.S. had hypertension as a primary or contributing cause. And so looking forward in the future, we hopefully want to have that changed. What happens, if you don't have this under control, your hypertension over a long period of time, you're increasing the risk of all these issues coming up. Increase, obviously these first two or three are the major ones: risk of heart attack, stroke, heart failure, but it can also affect the kidneys. It can cause vision loss, sexual dysfunction, and arterial disease, in your peripheral arteries, like in the legs. So it's it can kind of get out of control and cause all these other issues. And so that kind of wraps it up, and again, I want to thank everyone for being here. It's important to kind of get the knowledge, because I believe your best protection and prevention is knowledge. And so here are my references, and there's a lot of information online from the American Heart Association, the CDC, all these resources that you can refer to, to get more information. But I guess I'll leave it up now to any questions.
Yes, thank you so much, Doctor. I really appreciate that. I'm going to go ahead and share my screen so we can start with the Q&A session. And please be reminded that you can still submit your questions via our Q&A forum or also via the chat. Let me go ahead and share the screen. Perfect. And the first question that we have, Doctor, is this what the nurse is referring when they say your blood pressure is X over X? And I'm assuming they are referring to the numbers of the systolic and diastolic blood pressure.
Yeah, yeah. I wish I had, like, obviously this would be easier in person, or like a marker, but yes, exactly. That chart with the numbers, there is, like, let's see if maybe we can go back to it. Let me see.
Let me go ahead and stop sharing my screen, and you can go ahead and share.
Oh, okay. Thank you. So let me run back to it. Yeah. So this column, the systolic, is the upper number. That's the one on top. And then the diastolic, or this column, is the one on bottom. And so yes, that means, like, when a nurse says, let's say 120 over 80, that's what they're talking about, is these two numbers. Exactly.
Would you please share the screen again? Because right now we're not seeing the screen. Thank you so much, Dr. Nasif.
Let me see. Can we share the screen again? Because we kind of switched out for a bit. I guess that one. Okay, is that showing up?
Yes, we can see the screen. Mhm.
Okay, yeah, so again, yeah, sorry about that. So the systolic column is the upper number. The diastolic column down here is the lower number. So yes, when a nurse says 125 over 80, these are the numbers that she's referring to, or he's referring to, you know, is they're systolic over diastolic, and these are the ranges that we're looking at and what's defined as normal, elevated, stage 1, stage 2, or a hypertensive crisis. Yes.
Thank you so much for answering that question. And the next question that we have is there a specific diet that helps lowering the blood pressure?
Yeah, really, if you are hypertensive or on this range of the elevated blood pressure, really the like we were kind of covered a little bit here. Um, as far as diet goes, really it's just the main thing is sodium intake. You know, there aren't any special foods or, you know, sticking to one type of diet over the other, like a low carb or a low fat or something like that. Not necessarily, or a paleo diet. You know, that there isn't really much evidence to suggest that any specific diet lowers the blood pressure. It's mainly the sodium intake that you take throughout a 24-hour period. You know, that's what we're looking at. And obviously, the supplement of the alcohol on the side, this should also be limited to these recommendations. Yes.
Okay, thank you so much. And the next question that we have is how many times is needed to check the pressure if you have been diagnosed with high blood pressure?
If you actually have been diagnosed by your doctor, you know, or maybe at a fair or event or something like that, you know, the actual times per day is not so much too important, you know. And to be honest, there isn't like a specific number that you want to do, but the important thing is to set a specific time every day, and you want to make sure it's that same time every day. So generally, what I recommend is you know, doing it once when you wake up before you have any kind of coffee or breakfast or anything like that. You want to check the blood pressure at that time, and then maybe again one more time in the afternoon or the evening time, and keep a logbook. You know, actually write down the date and the time and the number that you get, the two numbers, the that 130 over 80 or whatever it may be. So keep a logbook of every time you check. But the main thing, yes, is making sure that you're checking it at the same time every day, so you're consistent with that, with those measurements.
Okay, thank you so much. And the next question that we have is, what does it mean when each arm reads different blood pressure reading when taken?
Yeah, there can be different reasons for that, you know. Some of those reasons can be quite serious, you know, if it's actually a drastic difference in those readings, you know. We we expect there to be some difference. They're not going to be exactly the same between one arm or the other, or, you know, some people check it even like if they have an injury in their arms, they can check it on their legs, for example. Um, they're not going to be exactly the same. There is some difference between those limbs, you know. Um, if there's a significant difference, and, you know, just for example, if between the two sides we're talking about more than like a 20-point difference on that top number. So let's say one side is 120 and the other side is 140. You know, it's that's kind of significant. And a lot of a lot of those reasons of what could possibly be are more on the vascular side of things. You know, there may be something going on within your in your vascular system. It's kind of hard to go into detail about it without, again, without kind of like showing you pictures, but um, it should be addressed with the family doc, you know, and they may have to get some imaging studies done of your vessels, you know, in the upper body, and to see what may be going on. But there is a, like I said, there is a expected to be a difference. Um, but if it's major difference, then it would need to be kind of evaluated further.
Thank you so much, doctor. And the next question that we have is, what is the normal blood pressure for 3 to 5 years old?
Oh, that's a good question. You know, I'm not very well versed in the pediatric side, you know, I don't know what their normal range, but I have to assume that we're still in that same range, you know, of the less than the 120 over 80. But don't take that uh, as written in stone. I don't know if I don't keep up to date with the guidelines for the pediatric patients, and I apologize for that. Um, but I don't think there's much of a difference there with what you're expecting with a 3 to 5 year old. Yeah.
Thank you. And the next question is, sometimes I feel my heart racing and unable to breathe, but my pressure is normal all the time. Doctors have stated that I am getting confused with anxiety, that it's getting confused with anxiety. Does this happen a lot?
So now we're kind of maybe talking about a little bit different things, because we have heart rate and we have blood pressure. So if somebody's heart rate is very high, that's heart rate meaning how fast the heart is actually beating. If somebody's heart rate is high, they'll feel it as palpitations, and you know, something in their chest like is just heavy. That's your more of your heart rate. um, and yes, your blood pressure can be perfectly normal, but you have a very fast heart rate. um, it can be confused with anxiety, and really anxiety is something that I do like to try to rule out first, you know, whenever I'm talking to somebody who's having those kinds of symptoms, you know, the palpitations. Um, and so, yes, it can be confused for that. What you want to do in that situation is, you know, if your doctor hasn't done it already, is getting an EKG. And so they'll put up their leads and see if there's an actual abnormal rhythm there. Um, If they don't find anything on just that one-time EKG, there's also something called a like a Holter monitor, where you may leave the leads on you and take the monitor home with you. It's like just something that you would put in your pocket or something, and you would do that for maybe 24 hours or 48 hours, whatever it may be, to try to capture it at home if you're not capturing it when you're there at the clinic. So if it's something that's concerning you, that you know you're having these episodes and you don't think it's anxiety related, then you know, talk about it more with your family doctor. Um, but it may very well be anxiety. It's something that is hard to distinguish sometimes, you know.
Absolutely. And right now also with COVID-19, with the COVID-19 pandemic, we do know that those numbers have increased in the population. So
Yes, absolutely.
thank you, doctor. We do have time for one more question. And the question is, does stress play a big role in high blood pressure? How worried should I be about my stress levels being high?
Yes. So stress, absolutely. I mean, it can have an effect, and similar to what we were talking about in this slide here. It says I'm sharing. Yeah, in this slide here, like that white coat hypertension. it's similar concept where, you are stressed out or anxious or something, and that blood pressure may be higher than it normally is. Um, so yes, it can have an effect. If you already have hypertension, then it can even make it worse. It can exacerbate it or aggravate it. It's just this is like the body's natural response to a stressful situation, um, because there are a lot of hormones and feedback mechanisms that happen throughout the body. So if you're in a stressful state, there may be an increased amount of kind of those stress hormones, and they raise the blood pressure up. So so yes, if that's something that you have in your life and you're someone who does have hypertension, you know, there you have to find a way to manage the stress, and that could be from many things. Everyone has their own ways of managing. Some are spiritual, some are more active, like exercise, or spending time with the family, or whatever it may be. But you got to find that thing that does it for you, that will help keep you calm and hopefully stress free. Everyone has stress, but we try to manage it, as best we can, our own way.
Thank you so much, Dr. Nassif. I really appreciate you taking the time to being here with us and for presenting to our Hidalgo County employees. I'm sure that we have all learned a lot of information regarding high blood pressure. So thank you so much for being here with us, Dr. Nassif.
Thank you all. Thank you for having me, and thank you all for joining. I hope it was something helpful and to take forward with you and kind of spread the knowledge throughout your families and friends, and yeah, thank you.
Thank you so much. And thank you everybody for joining us today. We do have one additional presentation at the end of the day. So I definitely invite you to join us for the COVID-19 presentation that we're going to be having at 3:30, and continue to visit our exhibit hall just for any information regarding the voluntary products that we have. And of course, we also have South Texas Health System and Rio Grande Hospital also available. So feel free to go to the booths. Thank you everybody for joining us, and stay safe and stay healthy.